did have one EMR prior to WRS, and it was called All Meds. The reason we switched was, one, it was too expensive, and two, it was a little outdated. I liked that it was web-based. I thought that was better than having a local software set up on our machines. I also liked that everything was included, sort of like an all-in-one deal. There was no nickel and diming and a la carte sort of setup. The digital pen has been phenomenal as far as the check-in process goes. When the patients arrive, we print off the new patient information and we hand them the new pen. And instead of doing like a bubble sheet scan process and assigning, it's literally we dock the pen and it's done. Dr. Birney had an old website, and what we did is we sort of converted it over to the WRS format. So it has like her mission statement, where she went to school, her qualifications, that sort of thing. We use the patient portal for a few things. Primarily, it is a tool to sort of give information to the patients, what insurance companies we take. Also, we like it because it gives access to all the records that we upload there, so the patients don't have to call us and we don't have to fax it anywhere or mail them. It also has the capability of letting the patients schedule themselves, so that's even another part where we don't have to be on the phone scheduling somebody or telling them how late we're open till. Frees time up for us in the office so we can actually focus on other things, like the patients are actually here. We sort of combined two of them. It's sort of a HIPAA/patient information sheet, so we've uploaded that. So before the patients even come to our office, they have the ability to fill that paperwork out, which saves even more time. Once they see the benefits of it when they call in and ask for a prescription, or they need a certain lab test or something, and they're not on hold for 5 minutes while we go grab their chart, I think that's when they start to realize, this is actually kind of nice. Implementation and training aspect was actually very smooth. Literally 2 weeks. By the time I talked to Chandrish to the time we were already in training was about 2 weeks. So the speed and efficiency was definitely there. Each training session wanted to touch on a particular topic, and then our main trainer, Risa, sort of left the floor open for questions, so she sort of tailored the remainder of the training session to our needs. I was amazed how quickly WRS got us up and running given our sort of predicament. We were running out of time with our last EMR. The single point of contact really makes communication with the company and our practice really efficient, because having Melissa sort of route our questions to the proper person really cuts down on the waiting time between a question and an answer. She'll let us know too, like, hey, I sent it over to so-and-so, they're going to get back to you. If it's just a quick problem with the EMR, we'll just create a ticket, send it over to WRS support team, and they'll get back to us within an hour. Dr. Birney has a few templates set up, and it's primarily for her surgery side, since a lot of the codes are the same for the procedures and things like that. So we have her, I guess, most popular used codes that she performs. We just kind of click the checkbox and it's done. It's almost like two different practices in one, and WRS manages them both. Surgery side, she has all the patients. WRS generates the claims, and all the charges are there. Then she has the patients come into the office for routine checkups, and she doesn't have to shuffle back and forth, charts to her house or charts to the surgery center. We are using the E-prescribing, and as far as on the practice side of it, it's really helped us because Dr. Birney doesn't have to write out hand prescriptions as much. And as far as the patients go, they don't have to wait around. The pharmacy already has it, and by the time they leave our office, it's already sent over there. So it's just way more convenient all around for everybody. It's remarkable how it can, check for contradictions. It immediately checks if the patient has any allergies to certain medications, and it'll check, all the types of drugs that could possibly fall into that category. It's safer for the patient. It's a security thing for the practice. I did check on a few review sites just to get an idea, and all the reviews were very positive. Yeah, absolutely. It saved us a lot of money. I was the initial person to sort of search everything and see if the price is right, if it's going to be tailored to sort of our needs. It's not just me who's going to be using the system, it's the entire office. So if somebody didn't like a certain aspect of it, it was imperative that their voice was heard. I actually love having the cloud-based system as opposed to having a localized database here, like our last system. I feel like it was sort of, it tied us down just to this location, and it was hard to almost move our data back and forth. Dr. Birney can access her charts anywhere over a secure internet connection. When she does go on vacation, I will set her up with one of the laptops, and it's just really convenient to carry around a light laptop rather than 20 paper charts. It was very important. There's a lot of EMR options out there. Not all of them are certified. It was a criteria that had to be met, just legality reasons, and maybe we wouldn't achieve meaningful use, and that's a big aspect for Dr. Birney. We've already started talking to WRS as far as the second year of meaningful use. The information has been fantastic. We're really not too worried as far as achieving meaningful use for year 2. We had the option of that capability with our last EMR, but the only stipulation was that we got charged for every sheet incoming and outgoing. So we actually never even enabled the incoming on our last EMR. But with WRS, since it's all included and we don't get nickel and dime for every sheet, it goes directly into the EMR. There's no scanning. We just assign it quickly. Everything is there in PDF format. We just put a check mark next to it and fax it off. We do see updates periodically, and there's never been a bad update. All of them seem to improve the software for the good. I like how when another practice maybe creates a template, or another ENT practice has a great idea, it's shared, so we get the benefits of their ideas as well, and it's a two-way street. Really get to know your own practice, how it functions, where you focus most of your time on, and find an EMR system that really caters to your practice. Look for the hidden charges too, because they're not going to be always upfront about it, and sometimes you're going to get a little sticker shock that first month when you're like, oh, faxing wasn't included, so you just rang up $200 in fax charges. Know what you're getting into, and don't be afraid to ask questions and point things out. Oh, absolutely, yeah. I remember speaking with Chandrish, and from day one, he's like, that's not our philosophy. We don't want to try to trick you into getting something you don't need. It wasn't like a car salesman, in your face, pressure to buy it. It was more like, what's going to be the best option for us? Before, with paper charts and things like that, and our last EMR, it was not very efficient. She spent a lot of time finishing up charts at home. There's no more tearing apart paper charts trying to find that one sheet to send off to the primary care anymore. She has a lot of extra free time that she spends. She's into photography, so she takes pictures. She has a dog that she absolutely loves. As far as free time, she has more of it.